established to ensure that nutrition as a whole is well coordinated in the Gambia, and it's well understood as well. Just to show Gambians that they have to mainstream nutrition in all their programs, that's all sectors of government, and also outside of government, that are related to anything we take in, it is nutrition. So that was one of the reasons. Also to educate people about nutrition. It's important to sensitize people generally, so that they know what nutrition is all about.
Nutrition is a cross-cutting issue, and therefore to make an impact as far as nutrition is concerned, there need to be a high level of coordination to read that the various players and actors in nutrition, their efforts are coordinated across the board. So that is exactly what the agency is doing. But in addition to the coordination, we also have the National Nutrition Policy covering 2010 to 2020, in which we are piloting and implementing some aspects of that policy.
It is against this background that the agency is working closely with all stakeholders, including communities and community-based organizations involved in nutrition and nutrition-related areas, to mainstream nutrition into other sector policies, programs and strategies, and better coordinate nutrition interventions in the country. The agency works closely with the Ministry of Health and Social Welfare at the regional level to reach out to communities.
It is very important for the Ministry of Health. They are supplying the Ministry of Health staff with these supplies at our maternal and child health clinics. So these are given to mothers and under fires by the health staff. And also this, in the case of complementary foods, they also provide materials and all the gadgets needed for conducting cooking demonstrations at nutrition centers, because here we have 2 nutrition centers, one at Bansang Hospital, one at Nyanija Chamin. So in all these centers, they are working with Ministry of Health to supply the foods necessary to give to these malnourished kids to gain the health status.
Until recently, nutrition was not recognized as a major development ingredient, and interventions in the area were largely negligible. But the steep rise in malnutrition amongst women and children forced a rethink in policy, culminating in the intervention of development partners such as the World Bank, which provided a $3 million grant through the Rapid Response Nutrition Security Project.
The reason that we are interested in nutrition really is because so much evidence has now shown the direct relationship of good nutrition and good development. And just to sort of indicate a bit of the kind of evidence that we are having, first of all, we know nutritional deficiencies, which come in many different forms and shapes. It's not just thinness, as you may know it, but many hidden nutritional deficiencies. What really triggered the bank to move further, to seek dialogue with countries, is the fact that these various nutritional deficiencies occur in the very early stages of life. During pregnancy, the first few years of life. This is exactly the period that the brain develops.
In order to achieve its desired goals, the National Nutrition Agency, as the implementing partner, operates through 5 main program areas at community level. This is an integrated approach that seeks to involve communities in the planning and execution of programs to achieve maximum returns. These strategies are the Baby-Friendly Community Initiative, the Baby-Friendly Hospital Initiative, Micronutrient Deficiency Control Program, Nutrition Education Program, and the Non-Communicable Diseases Strategy. The Baby-Friendly Initiative, or BFCI, is a community-led initiative that empowers communities through capacity building to identify nutritional problems and address them, in addition to preventing malnutrition among their members. It's operational in over 600 communities countrywide.
The package looks at maternal nutrition from the time the mother conceives. There are certain advices that the blood support groups will give And then when the mother delivers, they will also advise the mother to initiate breastfeeding at the earliest possible time so that the child can benefit from the colostrum, and also the early initiation of breastfeeding also brings about bonding.
They have been trained to such a level that, it makes life very, very easy for regional health office in terms of implementing their activities, not only NANA activity, but other health activities. When we talk about baby-friendly initiative communities, they don't only confine themselves to nutritional activities, but they go alongside with other activities as well. This is why you have vitamin A supplementation, and then they also have deworming. So you can also see we have, with the help of their intervention in communities, it has also helped reduce malnutrition in this region. So they have bodies that they train in those communities, and these bodies are the people responsible for the dissemination of information, nutritional and other health related informations in the community.
The BFCI works through a village support group composed of 8 members, 5 women and 3 men. This group is then trained on a wide range of nutritional, health and environmental issues such as promoting exclusive breastfeeding, environmental sanitation and health promotion.
We work in the villages through the village support group, but actually these are people who are working on a voluntary basis. They don't receive any remuneration from the agency, but they are citizens of the village, and they feel obliged that it's their responsibility, to try to improve the health and nutritional status of the people living in the village.
Follow, nin sate senando sita. Fundila, musolma na sato senyan.
When it is time for village cleaning, men should come out and join the women folk. This is because women are weak as opposed to men, and there are certain works regarding village cleaning that women cannot do. There are numerous benefits associated with cleanliness. It can improve one's health and protect you against certain ailments. There are places infested with snakes and mosquitoes, and through village cleaning, they can be eliminated.
Ora ninamo tasado kono. Jorol fanasisia, banale sado senani susulal fanasisia, banale sado senani bebu kasembo soto.
I have learned a lot now than before and can give advice, something I could not do before coming here. Exclusive breastfeeding is very important. The first time I registered, then I was pregnant and I gave birth to twins. That was when I realized the benefits. I was able to breastfeed the babies for the complete 6 months without going to the hospital for treatment, except for normal clinical visits. So I have seen the benefits of the breastfeeding program, and all those practicing it will do so.
Such knowledge could prove highly beneficial for communities with deeply entrenched traditions and customs which are difficult to change.
Before the coming of the NANA project, our knowledge about breastfeeding was very poor. I used to give water to my babies even before they reached 3 months. Sometimes even the first week after delivery, my mother-in-law will advise me to put salt and sugar into hot water and give it to my baby. Then I had no knowledge about the good practices I have learned now. Even concoctions were given to babies by marabouts, but we have stopped all that now thanks to the intervention of NANA.
Exclusive breastfeeding for the first 6 months is a prerequisite for healthy growth, and the campaign to raise awareness has been widely embraced.
The importance of breastfeeding cannot be overemphasized. Breastfeeding has helped restore my womb and stop the bleeding.